All right, we're live.
Good morning, everybody. February 10, the slaughterhouse of failure is not in our destiny. We shall persevere until we succeed. Og Mandino. So today we're going to talk a little bit about what I think it was Simon Sinek said, maybe Steve Jobs, but they said, identify a problem and then find the solutions. So if we identify a problem, the bigger the problem, sometimes the bigger the solutions. So we've got to look at where we are today and see where we can solve something or contribute towards a solution of something. And so Dan and I were looking, and an article came out this week about we've always talked about the sick state of our healthcare industry. I mean, that's one of the things that is one of our cornerstones of discussion is the sick state of our healthcare industry. There is no healthcare in America, it's sick care, we know that. There's even a very, very good video. It's a little documentary, it's a couple of minutes long, which we actually send to as many physicians as possible. For example, it's called Escape Fire. And maybe we should start with that one, Dan. I don't know if we want to pull that up a sec. I could do that, or if you want to pull it up.
I don't have it pulled up. I'm not at my home computer, so if you could do that, that would be great.
Okay, I will fiddle with that in a minute. So I'll pull that up. So in the meanwhile, basically, we wanted to talk about an article which came out about the sick state of our healthcare industry. So we, just as an opening salvo here, the United States spends more on healthcare than any other high-income country, but still has the lowest life expectancy at birth and the highest rate of people with multiple chronic diseases, according to a new report from the Commonwealth Fund, an independent research group. And again, there's another one that says the new poll shows jump in adults who rate the quality of US healthcare as poor. The report was released on Tuesday, and it says that compared to other peer nations, the US has the highest rate of deaths from avoidable or treatable causes and the highest maternal and infant death rates. That's astounding. Americans are living shorter, less healthy lives because our health system is not working as well as it could be. So this one comes from the Commonwealth Fund's International Program in Health Policy and Practice Innovation. Dan, if you want to take it a little bit from there, I'll find this video.
Yeah, it's a staggering statistic, obviously, that we're spending more on healthcare than any of our peer countries. There's a number of reasons for that. You know, we talk about them all the time, but first and foremost among them is are high enough of our population actually covered by insurance programs that allows them to go see physicians to catch these things early on? Are we practicing preventive measures the way that we should be, or the way that we could be, to catch these diseases at an earlier stage? And also, are we are our diets the correct diets to help prevent these diseases? And we know in all of those cases the answer is no. We have a very high rate of uninsured folks that aren't going to the doctor on a regular basis to catch these diseases in the early stages. We have a very poor diet. We have very poor nutrition available to us. We eat tons of fast food. We don't have enough fruits and vegetables in our diet. We don't have enough fiber in our diet. Our gut health is poor. All of these things then lead to poor mental health, poor physical health, poor, all of these things kind of add on top of each other and cascade into overall poor health. So, there's a number of different things that can be attributed to, and why we're not getting the best value for our healthcare dollars. much of the data in this new report shows trends that have been seen before. This is nothing new. It just validates the fact that we continue to spend more than anybody else and get the worst health outcomes. So we're not getting our best value for our healthcare dollars. Dr. George Benjamin, he's the executive director of the American Public Health Association, who was not involved in this report, said that the big takeaway is that COVID did not become the great equalizer among nations. It did not help our case at all. If anything, it exposed the existing holes in our healthcare system. And we've been talking about that for quite some time. And when you look at where we are and compared to some of these other nations, the one thing that we did appear to do well on was in cancer prevention and treating cancers early. Along with Sweden, we had the highest number of breast screenings or breast cancer screenings among women ages 50 to 69, and the U.S. exceeded the average when it came to screening rates for colorectal cancer. But are those screening rates high enough, and are we doing enough to prevent these diseases from occurring in the first place? Sure, catching them early is important, but even more important is trying to mitigate these diseases altogether. And we know there's enough data out there now. There's enough articles, there's enough journal, there's enough studies to show us that we can mitigate a lot of these things through proper nutrition and lifestyle choices.
Yeah, but Dan, here's something you've just said that I think is very, very important. On what Dr. Benjamin was talking about, that or we're talking about now, being able to lead in terms of cancer treatment and catching cancer, that's technology. But when we look at, we're good at technology, but we suck at the rest of it. So the technological part is great. Sure. But the prevention, it doesn't start with technology. The prevention starts when we were born in the lifestyle choices. So I can, if I can do this a second. So the lifestyle choices. So I'd like to show you this little video just for a second and see if we can play this.
You have to make sure you share screen, Lawrence.
Yes, sir.
Perfect.
Can you see the screen?
Yep.
Okay, so this is something we sent to everybody.
The American healthcare system is badly broken.
The present system doesn't work, and it's going to take us down. We need a whole new kind of medicine.
We're in the grip of a very big industry, and it doesn't want to stop making money.
If I spend 5 minutes with you and then put in one of these stents, probably get paid $1,500. For me to spend 45 minutes with the patient to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
We don't have a healthcare system in this country. We have a disease management system.
We're spending almost twice as much in America as any other country on earth, but our lifespan isn't even in the top 20.
30,000 Medicare recipients die each year from care they didn't need. That's the equivalent of a jumbo jet crashing every single week. If the aviation industry killed as many people, we'd be up in arms.
The administration pays you based on how many patients you see. All right, who's next? If you try and buck the system, someone says, what can we do to get your productivity up? I'm not interested in getting my productivity up. I'm interested in helping patients.
We're seeing the military just being a microcosm of the problems society's having.
Soldiers' use of prescription drugs has tripled in the past 5 years.
This medications I was on.
Only by accepting that the American healthcare system is badly broken will we be able to seek out the escape fires, the potential solutions. There are answers.
One company has figured out how to lower healthcare costs by more than 40%.
We provide incentives for people to engage in healthier behaviors.
The Army Surgeon General directed that we establish the Pain Management Task Force to take a look at alternatives to narcotics.
I was skeptical, so skeptical.
I've gotten a lot of inspiration, a different perspective. There's a different way of doing things that is possible.
If I think about what healthcare could be like, it would have a lot more care in it.
The healthcare system is unsustainable. We're really mortgaging the future, not just the health of healthcare, but the health of the nation.
So So basically, that is, I think, very, very right on the nail of where we are. And it has to do with what this whole article is about that came out, the study, not the article, the study that came out. And it has to do with our comparative poor showing with regards to other nations in their healthcare. I had a conversation this week, yet on day before yesterday, in fact, for the past 18 years, 17 years, I've been there's a physician that has a scanner and never really did much. She's kind of just hobbles around and so on. And I could never really get her to get really involved with preventive medicine and with understanding nutrition and so on. Well, this week I had a conversation with her office manager, and she said, I cannot tell you how happy I am that you've actually called me to single me out and not just usually go and talk to the doctor. She said, we've just been purchased by another group, and she told me the name, that have 1,000 clinics in Florida. She said, we are no longer, the doctors only work 3 days a week. They're being paid a salary and they don't really care. They've just been paid 3 days a week. And the people, the company that's taken them over are just interested in statistics and numbers. And I've been loaded, says this office manager, I've been loaded with 3 times the amount of work that I did have. And here in front of you, there are 2 chairs. These people quit last week. So this thing is completely broken. I don't know where we're going. I have no idea. I'm very, very concerned and stressed and distressed about the fact that we've lost our moral compass. We're no longer really interested in the patients. We're just interested in now. We're not even interested. We're instructed just to look at statistics and numbers. That's this one clinic that, by the way, has 7 or 8 clinics as well. But now they're part of this 1,000 group. So I'm trying to say that where there's a problem, the bigger the problem, the bigger the solutions, but we've got to be really aware of it. And we've got to understand where the problems are. And we're geared right now to be in the front row of being able to mitigate some of the problems that are coming up for everybody on their healthcare. If people are feeling and looking at these numbers and statistics and understanding that there is no healthcare, it's sick care. Well, we have healthcare. We are PharmaNext, our group. We are Nu Skin. We have a conversation. We have the solution towards contributing to a solution of healthcare, which is preventive medicine, and it's a common sense thing. But it's the least common of the senses. But other countries have understood this. We haven't. And we continue down the path of trying to put Band-Aids on trying to shut the stable for the horses once they've already escaped. That's why we're talking, you just mentioned, we're talking that we're good at helping to cure cancer. Why don't we prevent it instead of curing it? I mean, great that we cure it. Yes, that's fantastic. But it's a hell of a lot easier to prevent a lot of that stuff. Diabetes, cardiovascular disease, hypertension. I mean, now we've got another big one coming, which is mental disease. We've got to concentrate on these problems that are coming down the pipeline. We know mental disease. I believe I heard this week that 2 vets suicide a day. There's a suicide rate of 2 vets a day. What is this? Why? Can we not be better and do better?
You know, we know there's a problem. I mean, there's a huge problem. We're all on this call because we know there's a problem. Physicians knows there's a problem. It doesn't matter what specialty. Anybody that you talk to is going to admit the fact that we have a huge healthcare crisis here in the U.S., not only in the U.S., but globally. So, you know, from what Lawrence said in the very beginning, you know, Simon Sinek said, look for the problem and then look for a solution. This is a huge problem, and we have a great solution. In the video that Lawrence showed, they call those escape fires. Pharmanex is an escape fire. This is how we're going to escape that fire, or one of the ways, through dietary changes, through lifestyle choices, through showing people that they're unhealthy and showing them that there's something that they can actually do about it. I'm just going to lay some more statistics on you guys because it just validates what we're doing. Globally, healthcare spending has been increasing since the 1980s for a number of different reasons. Advancements in medical technology, rising costs of medical care, higher demand for services, things along those lines. But the US has the highest rate of people with multiple chronic health conditions, not a chronic health condition, multiple chronic health conditions. And we have the highest obesity rate among the countries studied in this particular article. In 2020, the life expectancy at birth in the US was 77 years. For the first time in human history, recorded human history, we're actually seeing life expectancy going the wrong direction. So, that 77 years, that's 3 years less than the average country that was studied in this particular article. And they go on to suggest that the data is showing that it's dropped even further in 2021. And I would suspect it's going to drop even further in through 2022. So, since the start of the COVID pandemic, more people died from coronavirus infections in the US than in any other high income country, according to the report. Why is that? Are our lifestyle habits that poor? Are our diets that poor? Are we that unhealthy compared to other countries? And the answer is a resounding yes. But there are some things that they suggest in this article that we can do, to get the best value for our healthcare dollar. One of them that I don't necessarily agree with is that we can, have universal healthcare or more access to healthcare for those that don't have access to healthcare. Sure, that's important. The second thing was that we can get more access earlier to those folks who are not able to have access. And then, we don't do as much primary care prevention as other nations are doing, which is very fractured, And then the third thing is, we under invest compared to other industrialized nations in societal things. They spend their money on providing upfront support for their citizens. We spend our money on sick care on the back end. So we need to change that paradigm. I know money, it's all about the money here in the US. We're not going to be able to help everybody, but what we can do is provide this escape fire to physicians who truly want to do something about healthcare in the US and helping their patients become healthier.
And within that statistic, there is 8.6% of the US population is uninsured. But just think about that for a minute. 8.6%. 8% of 300 is 24 million. 26 million people in the US are uninsured. So how serious is that? Well, it's not serious if you're generally healthy and you've got a good lifestyle and you exercise and you have a good mental attitude. But out of those 26 million, according to this statistic, how many of them are really in that category of health, of having a healthy lifestyle? Probably not all of them, not most of them. Some of them don't do it because it's too expensive. Some of them can't afford it. Some of them just don't want to do it because they think they can, spend less by being sick and spending it when they have to be sick or when they are sick. So, but 25 million people, that's a big market. And it's a big market for education about stop eating, eat an apple rather than junk. So we've got adequate information to know that we have a problem. We've got a problem generally that we've identified. The doctors themselves have problems now. they're burnt out. The doctors are seeing 20, 30 people a day. Those that are not absorbed by hospitals, those that are not absorbed by these equity fund, hedge fund groups. You know, those people, maybe not, but many doctors are burnt out. And they're now just mechanically doing symptom management. That's not medicine. We have such a huge, that's one of the problems. We got such a huge problem that we've got to identify where to start and how to pick at this problem. But the problem is there. We've got to get into the mindset of knowing that we can make a very significant contribution to mitigating the problems that exist. And we've got it all. And right now, $500 million in AI meets DNA. My God, how exciting is that? Where we can actually get everybody on board, and I say everybody, a lot of people on board, to look at being able to help people tangibly through what our technology is and what we have and the products that we've got that are not pharmaceutical based, you know, things that have collateral negative side effects. You know, you take a statin and they say that your liver may be impaired. So we've got solutions. We've got to now get into the mindset of enthusiastically approaching this and choosing where we want to have, where we can chip away at it.
Yeah, you know, if all these statistics weren't bad enough, you know, we've just been talking about, you know, access to care and how we care for patients and prevention. And, you know, you mentioned something about your physician burnout. You know, there was a link in that particular article to another article that I was reading. And you know, when it comes to burnout and all the administrative things that physicians now have to do that they didn't need to do, like EMR, electronic medical records and everything else, we were at the very bottom in administrative efficiency. So physicians aren't able to care for patients the way that they would like to, because it's being dictated to them by insurance companies and you know, venture capital and hedge funds that are controlling this whole healthcare system and the pharmaceutical industry. But we also landed last in administrative efficiency because of the time that providers and patients have to spend dealing with paperwork, with duplicative testing, medical testing, and insurance disputes. You know, those are some of the biggest complaints from physicians now, is that they're spending all of this time redoing work, spending a lot of time on EMRs, and having to deal with these insurance companies who don't want to pay for the proper testing, for the proper care of their patients. And so, you know, there's only so many times that these physicians can bang their head against the wall before they start to have long-term effects from it, right? And I've seen it time and time again where a physician just says, you know what, my staff is wasting a lot of time on phone calls with insurance companies and nothing's getting done, and they tell us we can't do this, and they've told us we can't do this X amount of times, and so we're just going to, you know, to save our sanity and save our time and be, you know, try to remain profitable, we're just going to, you know, we know they're not going to accept these particular claims or these tests or whatever it may be. So, you know, that is another entire driving force for why our healthcare system is so bad.
And time, you know, you mentioned, Dan, the electronic records. Well, here's a really good part of something that we can use in our chessboard, and that is all our business is cash, and there are no electronic records necessary, and the recommendation of a product is online, and it goes directly to the patient's house, and the doctor gets a commission on, or we all get a commission on what we're able to place. So the electronic records, which is literally half of the time that the doctor has with the patient, that doesn't exist anymore. So that's a huge solution. That's one of the big things. And if you bear in mind that two patients a day, 40 a month, getting a life pack, which is $79 a month, without charging for the scan, but with the rescan bonus and so on, the doctor will make $89,000 a year with 40 patients a month. How much time does it take Mary or John in the office to do the scan? 5 patients scanned, 2 of them on a supplement. That's 40 patients a month, over $80,000 a year, which is more than 20 some times the investment in a year. I mean, seriously, if we can't convey that message, where doc, you're seeing how many patients, what are you doing, all this stuff that's going on, and you're now in the hospital where you've now been told what to do, you've lost your independence, even with the new company that's taken over your business. You're told what you can do and what you can't do. You're not allowed to do this, you're not allowed to do that. What is that? Is that what you signed up for? Is that what the Hippocratic Oath was all about? So, you know, guys, it's really, really exciting times. And unfortunately, due to the big mess in which our sick care industry is.
Yeah, there isn't, you know, regardless of specialty, there isn't an independent physician out there that if you have a conversation with him and ask him or her if they're looking for ancillary revenue sources, there isn't one physician out there that's going to say no, right? So, but if you're not talking to these physicians, somebody else is with a different ancillary. And they're not looking for ancillaries to be greedy. They're looking for ancillaries to stay whole, to stay in business, to be able to provide for their patients the way that they, you know, for what they signed up to, which was taking care of their patients and helping patients become healthier. So, you know, if you're not out there having these conversations, you know, you're not going to be able to introduce them and educate them on what we have to help them. So, you know, I would implore all of you to have these conversations on a daily basis with whoever you can. You never know where that lead is going to go. And if you're, like I said, if you're not the one that's talking to them about ancillary revenue sources, somebody else is going to.
Yeah. So
you want to take comments?
I was just going to say, if there are any comments, anybody want to comment or say anything or contribute, please do so. We've got a couple of more minutes if anybody'd like to.
I was always told the bigger the problem, the bigger the paycheck. So,
well, there you go. It's another way to look at it. Yeah.
I think there's a lot of truth to that. But then the question is, how do you get that conversion or transition? It's funny. I just met with a practitioner at a networking event and was suggesting we get together so I can explain what this is about, because there is a process to this. And I get a text from the individual saying, all I care about is how much is the rental? How much is the rental? And of course, I'll be able to come up with a response to that. But more so, and maybe you guys can address this, is how would I effectively transition him from what's the cost per month to let's look at the bigger picture, because this is how you're going to help your patients.
I mean, I can see where they're coming from, because, you know, the rental is what the set fee is. You know, if he doesn't put patients on product, he's still going to have that rental fee. It's just like we talk about, you know, if that particular physician, if he's got his own practice, it doesn't matter how many patients he sees or what he charges them. If he doesn't charge them, he still has the same electric bill. He still has the same internet bill. So that's, you know, that's where he's coming from. What is my set fee per month? And the way I would approach that is, you know, look, you just need to put 4 or 5 patients a month on product to cover that in the beginning, and that's going to be covered. So it's really a non-issue, and that's kind of how I would talk to that particular physician about it. I wouldn't talk to him about, you know, I wouldn't go as deep at, you know, in that conversation as, you know, 80 patients a month and $160,000 a year, and you know, that's not what he's interested in. He's interested in what is my set fee and how am I going to pay for that so that my costs don't increase.
You know, it's interesting because you said something that is different than what I would typically say. It's really, you know, after 7 patients a month, it's paid for itself. But in fact, all you need to do is, like you say, put 4 or 5 patients a month on product, and it's the recurring income, you don't even have to scan at that point. You know, you're just making the revenues off the product sale.
Right.
And the
was
fact
totally
is that the fact is that the scanner is basically free, all apart from the insurance expense. Why is that? Because in fact, you're not paying a lease for the scanner. You're paying an amount which buys you scan credits, on which, by the way, you are commissioned. And the scan credits you pay $2 for, you sell them for $20 in your practice, or you give them away and put people on product. So effectively, the scanner is free of charge.
Yeah, I like that too.
Thank you.
And
John says it's not a rental, it's a lease, it's an agreement fee.
I tell them it's a lease and we do it for their benefit, because any other equipment that they have in their office, when I go into ODs, I mean, I was in one clinic 2 weeks ago and there was $6,000 to replace a lens. So you just explain in their language, hey, we did this for you because what we found is most practitioners are not ready to spend another $50, $60, $100,000 for a piece of equipment. So instead of doing that to you, we come in with a very minimal upfront, it's leased and you don't have nothing to worry about. So if it falls off the desk, if something happens, it's covered. You don't have to pay for that. You don't have to pay for the upgrade. So we actually did that because we checked physicians. Now, did you want to buy the machine for $60,000? And they'll go, no. Okay, great. And you just go right to your lease. That's you make it, you know, you just turn that to a positive, explaining why we do it, and it's for their benefit and it's in their favor.
Thank you. Dr. Joe.
Yeah, on that note, I mean, looking to cover your expenses is definitely a good business decision. But if you back up a little bit, and we've heard this before as, you know, distributors and reps, are we playing to not to lose, or are we playing to win? If the mentality is to your thermostat is, I want to pay my bills, guess what's going to happen? You're just going to pay your bills. But if your mentality is set to the thermostat to, I want to make a certain amount of money, then you're looking, your reticular activating system is looking for ways to bring in, as Dan was saying, ancillary income, which should be everybody. So you want to answer that person's question in short, say, I want to answer your question, how much the lease is. But, you know, when it comes to our practices, I'm sure you're looking to not just to lose, but you're playing to win. And we're looking for profit centers that are by definition profitable. So this is what the overall head is. This is what you take to break even, scan scores and so on and so forth. But in reality, you're adding a profit center that's going to take you to wherever you say you want to go.
Yeah. Okay, good. Thank you. It's a scarcity or abundance mentality as well. You're right. Shouldn't be afraid of. Shouldn't be afraid of. Of course, you got to know what it is.
Honestly, the scan lease is the dinner, guys. It's one dinner, a really nice dinner. You know, Valentine's Day is coming up. I hope everyone can spend that or half of that, you know, on their significant other. I mean, it's irrelevant. When you look at what the profit could come in, that's what matters most. And that's what you have to, whatever people focus on is what what they look at is what they're going to focus on. So if you want to focus on profit, then you'll have that. If you focus on your overhead, then you always got to worry about that. It's really, you know, it's, you got to, and you got to say it delicately and gingerly, of course.
Joe, thanks for reminding us about Valentine. I had it down to mention it, and then it kind of got lost here somewhere.
When is Valentine's Day this year?
February 14, whenever that.
Okay.
So, you know, don't forget that, because it's something that has cost me dearly in the past, where I was traveling somewhere and I completely forgot. I didn't even remember, didn't even bother to think about it. And I made my travel arrangements without thinking of Valentine. So think about that. Valentine is important to the significant other. Anybody else got anything? Dan, have you got any parting shots or anything like that?
No, I think I'm good.
Only to say simply, Dan, in your present circumstances, don't screw up Valentine's Day. That would be a very bad thing.
Yeah. Well, thank you for the reminder. I appreciate that.
Actually, gonna jump out in some kind of suits and scare the crap out of her or something.
There you go.
How romantic.
You're on the serious hook now, Dan.
Yeah,
now,
I know.
You're not just, you know, peripheral. Now you're on the hook, and it's serious.
I know.
So congratulations, Dan. He's getting married, and I think he's going to be a phenomenal father. he is with the two kids that he's got, that Kate and he have. And because you're actually a boy that didn't really have much of a
Never grew up.
never grew up because you were in the operating room. Yeah, you seriously, you 29 years, 24/7 on call. What kind of life is that? So
The doctor's life.
Those are the kids we're calling on.
Exactly.
so congratulations,
All
Dad.
right. Thanks, everybody.
What do you call it? Valentine for everybody on 15th. And thanks for being on the call. And we'll look forward to seeing you next Monday at 9:30 Eastern, next Wednesday at 9:30 Eastern, and next Friday at 8:30 Eastern time on the same channel. So blessings to everybody. Thank you. Have a prosperous week.
Thanks,
Thank you.
everybody.
Thanks, everybody.
Blessings.
Great job.
Blessings.
Congratulations, Dan.
Thank you.
When's the date?
Thanks.
March 7th in Costa Rica.
Beautiful, beautiful.
Yeah, we're looking forward to it.
He doesn't
Yeah.
want anybody to go there. That's why he chose, a
Yeah.
destination point. He was going to choose, some like New Zealand or somewhere. So
Lawrence tried to crash it. See you guys.
All right, take care.
Bye, Dan. Bye, Lawrence.